Welcome to Dr. Ravichandra official Pathology Tools YouTube channel. My dear students, today we will discuss a few introduction topics to pathology for all the undergraduates. Now, what is pathology? Pathology comes from the words combination pathos and logos. Logos is study and pathos is suffering. So pathology is study of disease or study of suffering, and it is a bridging discipline between the basic sciences, biochemistry, anatomy and physiology, and the clinical practice, that is medicine, surgery, pediatrics, obstetrics, gynecology and so on. Pathology is the study of structural, biochemical and functional changes in cells, tissues and organs that underlie diseases. You need to have a basic knowledge of normal anatomy, structure, and the function, that is physiology, to understand the pathology. Pathology deals with knowledge of what causes disease, how disease starts, progresses, and it explains the reasons for signs and symptoms of the patient. What is the importance of pathology? Pathology is an important part of medicine and it helps us to understand the disease, to diagnose the disease, and it also helps us to prevent the disease. It also helps to determine the treatment course of a disease. To work well in the healthcare sector, we need to have an understanding of pathology, cause without it, one can never be able to treat a disease properly. This is the reason why pathology becomes an important part of all healthcare branches. As per Sir William Osler, who is the father of modern medicine, your practice of medicine will be as good as your understanding of pathology. So, without understanding the disease or its pathology, you cannot practice medicine or medical field effectively. As I said earlier, pathology is the bridging discipline between basic sciences and clinical practice. What are the basic sciences? Biology, physiology, anatomy, biochemistry, histology, embryology, and so. And what are the clinical practices? Medicine, surgery, obstetrics, gynecology, community medicine, pediatrics, and oncology. How do we study pathology? Basically, this pathology has been divided into two main parts. One is general pathology and the other is systemic pathology. General pathology, it deals with the common basic reactions of the cells and tissues to the injurious stimuli. The basic mechanisms of development of diseases which are not tissue specific, that is, like inflammation, hemodynamic disorders, and general aspects of the neoplasia. Now, coming to systemic pathology. Systemic pathology describes the specific responses of specialized organs and tissues to defined stimuli. It deals with the alterations and underlying mechanisms of the diseases of particular organ systems. Example, cardiovascular system, respiratory system, hematopoietic system, genitourinary system, gastrointestinal tract, hepatobiliary system, female genital tract, etc. Now we will discuss what are the sub branches of pathology. We have many sub branches as the science is being evolving and we are going on new researches, advancements are going on. Our pathology has many sub branches. One is histopathology, the other is cytopathology, hematopathology, clinical pathology, forensic pathology, immunopathology, and molecular pathology. Now, what is histopathology? The name itself, histo, means tissues. So, it deals with the gross and microscopic examination of the surgical specimens as well as biopsies to study and diagnose the diseases. First, the tissue specimen is examined grossly. Representative sections are taken from it, which are then processed and very thin layers are cut and they are stained and they are being examined on the, under the microscope. Histologists, histopathologists work closely with the other clinical specialties. That's why a pathologist is also called as consultant of the consultants. Now coming to cytopathology. It deals with the diagnosis of diseases by examining pathological changes in cells. Histopathology is tissues, whereas cytopathology is cells, study of cells. Specimens include fine needle aspiration cytologies or FNACs from any body site, urine, CSF, body cavity fluids, and we have exfoliative cytology specimens like cervical scrapings, bronchial brushings, bronchial washings, sputums, buccal smears, etc. The most common use of cytopathology is, as all of you know, we have pap smears to detect cervical cancers. Now, hematopathology. It deals with the study of diseases of hematopoietic systems, including the blood. What are the blood components? RBCs, WBCs, and platelets, as well as bone marrow, lymph nodes, spleen, thymus, and other lymphoid tissues has been studied under hematopathology. Hematological tests help in the diagnosis of anemia, infections, bleeding disorders, hematopoietic malignancies. Now we will discuss about the clinical pathology. It deals with the diagnosis of diseases based on the laboratory tests of blood and other bodily fluids such as urine, using the tools of biochemistry, microbiology, hematology, and molecular pathology. A clinical laboratory has several sections: hematology, biochemistry, microbiology, urine analysis, serology, and immunology. Clinical pathologists work in close collaboration with medical technologists. So, most of the times, in a central lab where all the departments are being located, the pathologist will be the main person to check all these things. Now, forensic pathology. The role of forensic pathology is to perform the medico legal autopsies. We do medical legal autopsies because we want to know the cause of the death. So, the role of the forensic pathologist is to perform medico legal autopsies and determine the cause of death. They will collect and examine the tissue specimens for the possible cause of the death. Next, the evolving branch is immunopathology. In this branch, the immune responses related to diseases are being studied. It includes study of immune mechanisms, hypersensitivity reactions, immunodeficiencies, autoimmune diseases. Immunohistochemistry is a mixture of immunology and histology, and it applies the principles of immunostaining. So, in this process, we have proteins which are considered as antigens, and they are selectively identified in a tissue section by using the principle of antibodies binding specifically to antigens. The sorry, the antibody antigen binding can be visualized in different manners using a antibody labeled with enzymes or a fluorescent dye. Now coming to molecular pathology. Molecular techniques have been integral part of the practice of the surgical pathology. Molecular and genetic approaches are invaluable in two areas of surgical pathology, that is, one is oncology and the other is infectious diseases. Molecular pathology helps in definitive diagnosis and classification of neoplasms based on the specific mutational profiles. Techniques used are very much numerous. Polymerase chain reaction or PCR, reverse transcriptase PCR, fluorescent in situ hybridization or FISH, DNA microarrays. Now coming to the latest advances in our pathology, the word remember omics. Omics are the emerging technologies that deal with the study of behavior of the cells, tissues, organs at the molecular level. The characteristics of cellular molecules such as genes, proteins, or small metabolites are being studied here. So this omics is a suffix. So it is an emerging technology. This includes genomics, proteomics, metabolomics, transcriptomics. Now, genomics, it is the study of genes and their functions. Proteomics, it is the study of proteins. Metabolomics, study of molecules involved in the cellular metabolism. Transcriptomics, that is study of mRNAs. Now we will discuss about the bioinformatics. It involves management and analysis of biological data using advanced computing techniques. The US National Center for Biotechnology Information, also called as NCBI, serves as an integrated source of genomics information and bioinformatics tool for the researchers.